given at low doses, medium doses, and high doses. When given at low doses, or when only low amount of adrenaline is going to be released, it is more selective towards beta-2 receptors. GS receptors is going to be more binding with the GS coupled receptor, that is beta-2. Why? Because in blood vessel we have both alpha-1 and beta-2, which also we can see that in that diagram, guys. Both alpha-1 and beta-2 will be there in the blood vessel. But when it is released at low doses, it binds more with beta-2. There will be no binding with alpha-1. What will happen at medium doses? It will bind both with beta-2 and also alpha-1 in an equivalent amount. Equal binding with alpha-1 and beta-2 tends to occur. What will happen at high doses? More will bind with alpha-1 followed by beta-2. Right? First, it will bind with alpha-1, and after that, after some period of time, the norepinephrine will be reuptook, some will be broken down, and after that, the dose decreases and it will be more selective towards beta-2, guys. Simpler. If you understand that as the dose of adrenaline increases, or say as the concentration of adrenaline or adrenaline increases, it will be more acting on alpha-1. If the concentration decreases, it will bind with beta-2 again. Right? What will be the response? From the first diagram, we can see if it is binding with beta-2, beta-2 produces vasodilatation, so the BP tends to fall down, decrease in the blood pressure. The second diagram, both alpha-1 and beta-2 are equal. So alpha-1 induced vasoconstriction, beta-2 induced vasodilatation. No major changes there. BP will not be altered when adrenaline is given at medium doses. But when adrenaline is given at high doses, initially there is going to be vasoconstriction followed by vasodilatation. Which means there is going to be, if you want to put it up in a diagram, in a chart regarding the blood pressure. So consider here is where the flat line is. Now here we have administered adrenaline at high doses. Now what will happen to the blood pressure? Initially, because of its binding with alpha-1, there is vasoconstriction, BP will rise. There is going to be increase in blood pressure followed by a prolonged decrease in the blood pressure because of its binding with beta-2. And again it will come back to normal. Here we can see a two-phasic response is there for adrenaline. This is what we term as a biphasic response in the blood pressure, my dears. This is what called as biphasic response in the blood pressure. So, which can be seen only with adrenaline. Why is there an increase in the blood pressure, guys? Because of its action at alpha-1 receptor. Why is there a decrease in blood pressure? Because of its action at beta-2 receptor. Now, let's rub it off, right? Let's rub it off and let's try to do one more. We just try to add some more points here. Consider, I'm going to have a flat line here. I'm going to have the BP is going to be in flat line. I'm going to administer adrenaline at high doses. But before that, what I do, I administer an alpha blocker agent. Very simple. Well, you can understand, some of you or all of you can even guess what was going to happen. When you administer an alpha blocker, now what will happen to the blood pressure, guys? Is the blood pressure going to increase? No. The increase in blood pressure is not going to be seen. There is just going to be a decrease in the blood pressure. Right? If, for example, you have taken an animal, and in that animal, you have given the, you are monitoring the blood pressure in the monitor. You have administered an alpha blocker, and now you have administered adrenaline to the patient. You expect an increase in blood pressure in that monitor, but that is not going to happen. Instead, the reverse thing is going to happen. The inverse thing tend to occur. Instead of increase in blood pressure to occur, there is going to be decrease in the blood pressure. This thing was demonstrated by Professor Dale, and that's why this thing is called as vasomotor reversal of Dale. Vasomotor reversal of Dale, and which can be seen whenever we give an alpha blocker and followingly when we give adrenaline. Please note that this biphasic response in blood pressure can be seen only when adrenaline is given at what doses, my dears? Option A, low dose, medium dose, high dose. Yeah, high dose. It is seen only with high doses. It is not seen with low dose or medium dose, my dears.